Okay, we're talking with board certified orthopedic surgeon Dr. Kevin Crawford from Crawford Bone and Joint. How you doing, doctor?
Good. How are you this morning, Carrie?
Fine, doing fine. A little warm out
Great.
there, today, but we're good.
It is.
So I got a few questions here we'll get into. For people who may not know what exactly an orthopedic surgeon does, and what are some of the most common reasons patients come and see you?
Uh, we in orthopedics kind of think of ourselves as the people that take care of bones, joints, ligaments, tendons, pretty much throughout the whole body. Uh, Not so much focus on the head or neck area, but certainly anything below that: shoulders, elbows, joints of the hip, knee. Of the lower extremity, all the way down to the feet and toes, and all the way out to the fingers. So any pain issues with these areas is something that we in orthopedics take care of.
Yeah, that leads me to my next question. A lot of people live with joint pain for years. How can someone tell the difference between normal aches and pains and a problem to where they have to be evaluated with you?
That's a good question. I kind of almost feel like the question is a little bit philosophical because uh, I think that we are here for patients with all types of pain and all types of complaints, whether they be major complaints because they've broken a bone or dislocated a shoulder, let's say, or have severe disabling foot pain or whatever it might be, all the way to your basic aches and pains that a lot of people will attribute just to aging. But a lot of times in orthopedics, we have treatments, and especially at our clinic, I feel that we're kind of unique in being able to treat a lot of things in a very conservative manner, meaning without surgery, for, again, these more serious injuries, but also the aches and pains that seem like they're a routine and normal part of life. But a lot of times we do have options for you with those types of complaints as well.
Yeah, we'll get into those options. Joint replacement surgery, it's come a long way, I know. What advances have you seen over the years that have improved recovery times and patient outcomes?
Yeah, I think that the throughout my career of several decades, more than 20 years, I've seen changes in knee replacements, hip replacements that really benefited patients. It's been a gradual evolution, and it's a really nice and stable evolution. So there haven't been major hiccups, setbacks, or things like that with the changes that have occurred. One of the things that we do have that's very different now than, let's say, 10 years ago even, is that we're able to do these joint replacements, be it knee replacement, hip replacement, shoulder replacement, etc. We're able to do these as an outpatient, and so patients benefit greatly from being able to recover at home. We'll have physical therapists come to the house, we'll have visiting nurse come to the house, and patients really enjoy that experience much more so than in the hospital setting. And in fact, patients do better when they recover at home than in a hospital setting. So that's a big advantage, big advance.
Yeah, that's huge for sure. Some of the conservative treatments you were talking about, not every orthopedic problem requires surgery. What are some of the alternative methods rather than surgery?
Yeah, I think that at our clinic, we pride ourselves in being, first of all, very empathetic. Secondly, very accommodating to the patient, understanding kind of the situation that they're in, whether their injuries or complaints are, again, large or small. We're very accommodating of those things. But the other side of it is that I think that we are very progressive in terms of looking for and finding different alternatives to the kind of traditional treatment of some of these bone and muscle joint disorders. For example, knee arthritis is an excellent example. People who have intermediate stages of knee arthritis at our clinic have a great option, which is what we call gel injections. And these gel injections are not cortisone, they're relatively painless. But for people in that stage of arthritis, they provide a lot of relief and certainly can reduce or put off joint replacement for many, many years. We have lots of patients who've been getting these kinds of shots over a period of many, many years and have not succumbed to knee replacement as yet.
Yeah, that's awesome. If you could give anyone a piece of advice to keep their bones and joints healthy as they age, what would it be?
My perspective on that is probably a little bit different than most doctors would talk about. I think that staying active is one of the most beneficial things that you can do. Obviously, keeping weight under control is important, but honestly, that's difficult to do in our society today with so many different factors. I think that tobacco is, generally speaking, harmful for joints. Alcohol, there's pretty good studies that show large amounts of alcohol are harmful and create problems with joints and can lead to arthritis as well. So I think those are the things. And again, I would emphasize maintaining some kind of activity. I think people in our area are active. We see so many people going to the gym now, utilizing the gyms and the fitness areas that are available in our community here. It's a great thing.
Yeah, they have that fitness area in Garden City Park there that
Yeah,
I wish more people took advantage of.
exactly. I drive by that on my way to work every day, and I look at people walking, and not only is there the track outside, the walking track, but the facility, as you mentioned, inside, which is a great advantage for our community.
Yeah, and the Radcliffe Center, the community center, a lot of activity going on there for sure.
Absolutely.
So you've cared for a lot of patients in the area. What's it meant for you personally, and what keeps you committed to serving the community?
Um, Great question. It's it's so important to me. I have a large family with in my own children, brothers and sisters, and they're some of my patients, my lifelong patients too. But really, the reason I bring that up is because my patients here and patients that I've had for 20 years or more, or even the patient who I see for the first time, they become our family too. And it's not just me. My people are working in the office have this attitude, this approach where we consider patients family, and to see them get better. To see, just this morning, I had a patient came in 4 months after her knee surgery. She's doing great. She's a younger person. It's very gratifying, very fulfilling to see people recover from injuries in the way that most patients do.
Yeah, that's very gratifying, I would imagine, for sure. So you do a lot of surgeries at other hospitals, correct? What hospitals are you working out of now?
Primarily Garden City. I do work out of the Corwell Hospital down in Wayne, Michigan. Annapolis is what most people know that as, and we've been to those hospitals for quite some time.
Hmm. So was there any other items or anything else that you would like to cover while I have you here?
I think that just to talk about some things, specifically we mentioned the gel injections. That's kind of unique to our practice. I think a lot of orthopedic surgeons don't offer that to their patients. So as a alternative or option for knee arthritis, I think that's something that we're very special with. I think that the other thing that there's a couple other things that I do in terms of hand surgery. One is being for arthritis of the thumb, where we have a special technique for treating that that it gets great results. Also, we see a lot of people in this area with carpal tunnel syndrome, and we have an endoscopic or a minimally invasive treatment for carpal tunnel syndrome that I think is very unique to our practice and very beneficial to our patients.
So when you say thumb problems, is that surgery or is it injection or what is that?
Yeah, we certainly try the conservative treatments for thumb arthritis. It's arthritis that this part of the thumb. I don't know if that shows up well, but arthritis in that part of the thumb is a very common disorder. As we age, it's very common, and so sometimes braces, sometimes physical therapy, sometimes injections come into play. But that arthritis can be very disabling despite all those conservative treatments. So we do have a kind of a special treatment, surgical treatment that we do, which is a thumb replacement, which would look very similar to a hip replacement on a much smaller scale, but provides great relief and great function after the procedure.
That's awesome. That's very interesting. Now, the gel injections for the knee, that goes into the joint. It provides what, a cushion in there, or?
Yeah, it's a good way to think of it, Kerry. It lubricates is another way to talk about it. There's actually a more sophisticated explanation on a biochemical level, but we talk about it as lubrication and providing that cushion where the normal cartilage has been lost, and so that's exactly the way to think of it.
So at your clinic there, you can provide X-rays, injections, everything except the surgery, right?
Within the clinic, right. And of course, if a patient needs surgery, that's an option that, we discuss.
Mm-hmm. Is Alyssa there? Because I've been dealing with her. I was just wanting to give her a shout out as well.
Let's give a shout out to Alyssa. She's nearby, and here she comes, lo and behold. But that also is a nice segue, Carrie, for me to talk about. We've taken her by surprise, so this will be interesting. But it's a nice segue to talk about what I think is probably the most important identity of our practice. There she is. She's been with us.
Nice to meet you. Thanks for arranging all this.
Yeah, nice to put a face with.
Yep.
Yeah, we have great people here. Alyssa, obviously being one of them. But as I was saying, the real important and differentiating thing about our practice is that perhaps I have some unique features, and I'm a good surgeon, et cetera. But really, the amazing thing about our practice is the other people that work here, and people will have a great experience in this practice. So, loving being in the community and loving providing service for many, many more years.
Well, we're happy to have you, that's for sure, and we really appreciate you taking the time out to come on the show.
Absolutely, Gary. I appreciate you. Look forward to talking again sometime.
Yeah, absolutely. You have an open invitation anytime you're ready. Just let me know.
Thanks very much.
All right. You take care. And Alyssa, you take care as well.
Thank you for bringing her on.
Thank you.
Yep. Bye-bye.
Bye.